The way you interact with your healthcare clinic is about to change. On April 16th, Well Health Technologies, ticker symbol WELL on the Toronto Stock Exchange, announced it had entered into an agreement with Shoppers Drug Mart to acquire all of the primary care medical clinics operated by Shoppers under the name The Health Clinic by Shoppers. Now, this expansion into Well's Canadian clinic network means patients can look forward to the integration of digital workflows, next generation patient engagement technologies, and the implementation of advanced AI tools. To talk more about Well's strategy when it comes to clinics, we are joined by CEO Hamed Shahbazi. Thank you so much for being with us today, Hamed.
Great to be with you. Thanks for having me on.
I want to start with this. You recently made an interesting acquisition with the recent announcement regarding the absorption of the Health Clinic by Shoppers, which you acquired from Shoppers Drug Mart. Could you outline Well's strategy for integrating these clinics into Well's clinic network?
Absolutely. Yeah, we're really thrilled to have the clinic by Shoppers join our network. I think this demonstrates how relevant and key we have become to the Canadian healthcare ecosystem. Of course, Shoppers is the largest pharmacy chain in the country, and for them to decide that those clinics should be under Well's care rather than theirs demonstrates the respect that they have for our ability to own and operate clinics, which really, I think most people would say we're in a league of our own in terms of being able to own and operate clinics profitably and support physicians. And so a big part of what we are doing with those clinics is adding software and workflow and alleviating a lot of the low leverage activities that clinicians have to support so that staff can be freed up to handle higher leverage work in terms of supporting doctors better. This creates a much more well operating enterprise, and so this is really key for us, and we think that there's more opportunity to work with Shoppers once we fully integrate and do a great job with these 10 locations.
And can you provide some insight into Well's clinic absorption program and what role this program will play with Well's future growth?
Yeah, I'm glad you asked that. The absorption program is a new program for us that only really started to show up about a year and a half to 2 years ago. Before that, our recruitment efforts were focused on recruiting individual physicians to come into the clinics that we already had operating. What started to happen is we started to hear that physicians, wanted to come as a team. They actually, found that their clinics are not operating as well as they would like them to operate, and this is because of all the administrative burdens that they have in running these clinics. And so the idea of working within a fully managed network like Wells, where we can provide technology support, administrative support, and really operational excellence becomes really attractive. And so clinics that normally people were paying millions of dollars for now are being attracted to our network, and they're essentially saying, "Hey, we'd love to join your network, and we'd like to be reimbursed at nominal cost, meaning like little to no costs, just so we can be part of your network and you can help us operate." So this is really a sea change in what we're seeing. We've never seen anything like that in Canada before, and certainly you don't see anything like that in the United States, where private equity loves accumulating and consolidating healthcare clinics of all kinds. It's due to the resilient nature of the asset class. And so one of the things that we've been able to really demonstrate is that physicians can get a bunch of their time back because they're no longer running a business and they can focus on the care. So they tend to actually deliver better patient output, which due to fees for service results in better income for them. And so they're happier. Some of them just take that time that they get and they live more balanced lives. So it's really substantial for us to be able to do that. And when we talk about our absorption program, we're really talking about organic growth, because again, we're able to attract and recruit these locations at nominal costs. And when I say nominal cost, we're really talking about less than 0.02 times revenue. So really, really low cost.
Over the past year, also, we've seen provinces update their reimbursement rates for healthcare, kind of with a focus on primary care. Alberta, Ontario were the most recent provinces to do so. So, how do these changes affect WELL's strategy for its primary care clinics?
I'm glad you asked because in healthcare, reimbursement is everything. If you think about healthcare, it's a two-sided marketplace. There's enormous demand because it's free to go to the doctor. And so a lot of the action becomes in the supply. And so Well's done a great job acquiring physicians. And we have the largest physician network in the country in the outpatient market. And those physicians provide mainly fee for service. Those physicians essentially get paid what the government provides for as part of their rate tables that are updated, very infrequently. And so recently, all the major provinces have indicated or announced very significant increases. So last year in British Columbia, we saw 5 to 10% increases in reimbursement, mainly for primary care. Ontario weeks ago just came out with a straight across the board 2.8% increase. In Alberta, we've seen increases 3%. That's 1% per year over the next 3 years. Manitoba recently announced changes that would result in some cases more than 10 or 15% increases in reimbursement for primary care. So these are enormous changes. I mean, typically in healthcare, you could go years without seeing increases like this, and we are seeing this, I think, as a result of there being a lot of concern about the lack of physicians in the marketplace and whether or not they're leaving to the United States or they're getting out of the profession because there isn't enough upside for them in terms of being able to earn and pay all the expenses that they need to and deal with all those administrative burdens. And so we're hearing a lot about the concern that doctors are facing out there. And so this is after, one would say, some years of neglect. The Canadian government is really, really coming through. And that's a definitely a game-changing moment in the sector. And I think people need to notice.
It's definitely significant. And I also want to switch over and talk about Well's considerable move to artificial intelligence. We've been talking about that so much lately. Well continues to focus on AI and its applications in healthcare. Can you describe how specific AI tools are being used in clinics and the impact that they've had?
Sure. I mean, this is a big area for us. If you think about it, our North Star as a company is to tech enable healthcare providers. And a big part of the future of healthcare is going to be physician co-pilots. These are artificial intelligence powered co-pilots that essentially help the physician with all the enormous administrative and basically all their other requirements to render care. And I'll give you a great example. We see this all the time. Physicians, for example, in primary care, are getting paid, depending on the jurisdiction, anywhere from $25 to $35 to see a patient. That patient could come with hundreds, maybe even thousands of pages of patients' data that is coming from past consultations and hospital visits and surgeries and radiology scans and all kinds of different things. And so a physician is supposed to familiarize themselves with all of that data so that they can provide the best care possible. It's really just not even physically or humanly possible for them to do that. And so a lot of physicians find it extremely difficult to be able to provide care in the way that the College of Physicians and Surgeons provides for. And so what AI does a great job of is take an enormous amount of complexity and create simple insights. And so one of the things that we've done is we've launched our first generation disease detection tool that we call Well AI Decision Support that scans for a significant number of diseases and is able to help risk stratify the patient. So the patient will pop up as high risk or medium risk or low risk. And this really helps the physicians so that they don't have to go out and read all of that data. The other thing that we've introduced is a AI-powered ambient scribe. And this is listening to a patient-provider conversation in a compliant way with informed consent, and is able to then transcribe and convert that transcription into a medically relevant note, which solves significant amount of the administrative burden on a physician. So these are the types of products and services that we are deploying. Our view is that in the next, 5 to 10 years, the experience of being a physician is profoundly changed with the use of these co-pilots, and physicians can now focus a lot more on the patient as opposed to trying to capture all of the administrative aspects of that visit, if that makes any sense.
It makes complete sense. And it feels like this is just the beginning. So looking forward, what do you feel are the next steps for AI within Well's business units?
I think you're going to see us continue to expand Well AI decision support. We've launched a first generation. We are on the verge of launching a second generation that will involve things like chronic disease detection. Now you start getting into really one of the big areas where preventative care can be extremely helpful, because so many people are underdiagnosed, undiagnosed, or misdiagnosed, and being able to help physicians identify these patients efficiently and effectively with the use of data, I think is going to be really constructive and very helpful for physicians. And so, you know, as these decision support algorithms get more productive, and as we add more disease detection, this starts to become a bit of a foolproof tool that doesn't make the decision for the physician. It's merely supporting their decisioning, which is, I think, really key, because none of us want to see the robots and algorithms make decisions. We want them to provide more data and insight so that they can make our providers smarter, so that they can make those decisions.
Looking forward to seeing where this goes. Well Health Technology CEO Hamed Shahbazi, thanks so much again for being here today.
Great to be with you. Thanks so much.